this is Dr. Emma Hitt-Nichols, and this is the new FDA approvals podcast for April 26th through May 3rd, 2024. Okay, first up this week, the FDA has approved Valbenazine, also called INGREZZA SPRINKLE, for the treatment of adults with tardive dyskinesia and chorea associated with Huntington's disease. This new oral granule formulation provides an alternative administration option for those who experience dysphagia or have difficulty swallowing, offering the same dosage strength as the original capsule form, which can be sprinkled on soft food for easier intake. Valbenazine, initially approved for these indications in its capsule form, is a selective vesicular monoamine transporter 2 VMAT2 inhibitor. It is designed to inhibit the release of dopamine, a neurotransmitter involved in controlling movement, thereby reducing uncontrollable movements associated with these disorders. Tardive dyskinesia is characterized by involuntary repetitive movements, primarily affecting the face and upper body. Huntington's disease is a genetic neurodegenerative disorder causing motor dysfunction, cognitive decline, and psychiatric symptoms, with chorea being one of its primary movement disturbances. The FDA approval of Valbenazine in this new formulation was based on data demonstrating its bioequivalence and tolerability compared to the original INGREZZA capsules. The approval of Valbenazine was granted to Neurocrine Biosciences, Inc. The FDA has approved Tisotumab vedotin-tftv, also known as Tivdak, for adult patients with a recurrent or metastatic cervical cancer who have experienced disease progression on or after chemotherapy. This approval represents a conversion to full approval from accelerated approval, which was initially granted in September 2021 based on tumor response and durability from the INOTV-204 study. Tisotumab vedotin, an antibody-drug conjugate, ADC, functions through a mechanism where it binds to tissue factor on cancer cells, leading to the internalization of the ADCTF complex and subsequent release of the cytotoxic agent, monomethyl auristatin E, MMAE, that disrupts microtubules, causing cell death. The full approval for recurrent or metastatic cervical cancer was based on results from the global randomized phase 3 INOTV 301 clinical trial, which demonstrated a significant overall survival benefit of tisotumab vedotin compared to chemotherapy. The trial reported a 30% reduction in the risk of death and a median overall survival of 11.5 months for patients treated with Tivdak versus 9.5 months for those receiving chemotherapy. The approval of Tisotumab vedotin was granted to Pfizer and Genmab A. The FDA has approved mavorixafor, also called Xolremdi, for WHIM syndrome, that's also called warts, hypogammaglobulinemia, infections, and myelokathexis in patients 12 years of age and older to increase the number of circulating mature neutrophils and lymphocytes. This is the first approval for mavorixafor, a small molecule CXCR4 antagonist that acts by blocking the receptor to enhance the release of neutrophils and lymphocytes from the bone marrow. WHIM syndrome, a rare genetic disorder, impairs immune function by reducing circulating mature neutrophils and lymphocytes, critical for combating infections. WHIM occurs in about 1 in 5 million live births and is associated with a high risk of recurrent and potentially life-threatening bacterial and viral infections. The approval was based on findings from a 52-week randomized double-blind placebo-controlled trial demonstrating that mavorixafor significantly improved absolute neutrophil and lymphocyte counts. The treatment also notably reduced the infection score by 40% compared to placebo, although it did not improve warts. The approval of mavorixafor was granted to the manufacturer X4 Pharmaceuticals. Also last week, the FDA has approved the Esprit BTK everolimus-eluting resorbable scaffold system, Esprit BTK system, for chronic limb-threatening ischemia, CLTI, below the knee, BTK. This is the first approval of its kind for a device in this category in the U.S., as previous standards of care were limited to balloon angioplasty, which often resulted in recurrent blockages and additional treatments. The Esprit BTK system uses a novel approach with a dissolvable stent, similar to dissolving sutures, designed to support vessel healing and keep arteries open. It gradually dissolves after providing the necessary support for about 3 years, ideally leaving a healed and functional vessel. Chronic limb-threatening ischemia is a severe form of peripheral artery disease, PAD, characterized by blocked arteries and reduced blood flow to lower limbs, leading to significant pain, non-healing wounds, and sometimes necessitating amputation. CLTI has a notably poor prognosis. The approval was based on findings from the LIFE BTK trial, which showed that the Esprit BTK system significantly reduced disease progression and improved medical outcomes. The approval of the Esprit BTK system was granted to Abbott Laboratories. All right, that's it for this week. I thank you so much for listening. Please do tell your colleagues about this podcast. Just say, hey, this podcast is really great. It helps me stay up to date. It's called the New FDA Approvals Podcast. I'm also offering a course on AI in medical writing, so you can check that out. LearnAMAstyle.com. Go to LearnAMAstyle.com for access to that. It's coming up depending on when you're listening to this, it's coming up in the next few days where you can register for that course, AI in medical writing. And there's also lots of free downloads and all cool stuff. If you're in the industry, it will help you with your writing and editing. All right, thanks so much. Have a great week.